Hey everybody, welcome back to the show. So in today's video, we're going to start a deep dive into Medicare, and we're going to specifically look at original Medicare versus Medicare Advantage, how each of them work, and the pros and cons of each. Now this is part one of a 3-video series. You can find links below this video to parts 2 and 3. Part 2 will cover how you can change your Medicare, either your policies, the type of Medicare you're getting, if you already have it, and we'll talk about that in video 2, because you can, during certain periods of the year, change the type of Medicare insurance you have. And then in the third video, we're going to look at how to get help figuring all of this out and the pros and cons of the different types of help you can get and the things you need to know about the sources you can go to, the resources you can use, to help sort all of this out. So let's dive right in. I'm going to first begin with original Medicare, and I'm going to use this document as a little bit of help, and I'll link to this below the video. This actually comes from Medicare. This is there. I'll show you we'll go back up to the first page of it. This is Medicare and You 2026. So this is hot off the presses. It is 128 pages long. The good news is we're not going to look at all 128 pages, just a couple actually. But it's a great resource to have. As I said, I'll link to it below this video. And we'll start with original Medicare. They're describing it on the left. And original Medicare consists of Part A and Part B. Now, why do they call it original Medicare? They call it that because when Medicare first came into existence, go all the way back to 1965, it was passed into law, it started in 1966, you had Part A and Part B. They were original. Some of the other parts of Medicare that exist today, like Medicare Advantage and Medigap plans, didn't exist back then, and neither did Part D. So that's why they call this original Medicare. And we can pop up here and we can see what it covers. But basically, Part A covers your hospital insurance and other things, as you can see here. But I think most people think of this as hospital coverage. And then Part B, they call it medical insurance, but this is kind of everything else. When you go to visit the doctor and the doctor orders lab work, you need to get an MRI or an X-ray, those kinds of costs fall under Part B. And those together are original Medicare. If you're on original Medicare, these get administered by the government. You use your Medicare card, and that's how you get Part A and Part B coverage. Now, a couple of things we need to know about this. First of all, with some very limited exceptions, Part A and Part B do not cover prescription drugs. So that leads us to Part D. That's an add-on. You can purchase a drug plan, a Part D drug coverage, if you want to, and we'll look at some examples of that in a minute. If you're going to buy that, even if you're part of original Medicare, Part D gets purchased from an insurance company. That doesn't get administered by the government. You buy that from an insurance company. Again, we'll look at some examples. Now, we need to understand that Part A and Part B Medicare, they don't pay for 100% of the costs of this coverage. So what do you have to pay? Well, first of all, you might have to pay a premium. For Part A, most people, I think 99% of folks, don't actually have to pay the government a premium for Part A because either you or your spouse has already paid for it through the payroll taxes that get taken out of your check if you've worked for 10 years or more. And so they call that premium-free Part A, but the vast majority of people don't have a premium for Part A. You do, however, have a premium for Part B. We can look at that here. Again, I'll link to all of this below the video, but in 2025, the premium is $185 a month. It's going to go up in 2026. We don't know the exact amount, but it's going to be roughly $206. Here, let me throw my ugly mug up there on the screen so you can see there's a real person talking in this video. Yeah, it'll go up to about $206 next year. Right now, 2025, it's $185. It also, for some folks, can be higher than that. You've probably heard of IRMAA. That's an acronym, IRMAA. It stands for Income-Related Monthly Adjustment Amount. I know it's a mouthful, but it's based on your modified adjusted gross income from 2 years earlier. And of course, depending on if you're a single filer for your taxes or you filed jointly. And you can see here, let's see, here's the current schedule. And you can see, depending on how much you make, you could be paying as much as $628.90 a month for Part B. All right, so keep that in mind. Part A, most of the time, is premium free. Part B has a premium. It ranges currently from $185 a month to over $600 a month. Now, that's just the premiums, right? There are also deductibles and co-insurance. So how do those work? Well, they're different for Part A and Part B. We can go, let's see, here for Part A. And here we're talking about, most people, again, think of this as hospital stays. So there is a deductible, and in 2025, it's $1,676. So that's your deductible. Let me see if I can make this a little bigger for you. And then depending on how long you're in the hospital, you have coinsurance. So for the first 60 days of what they call a benefit period, and you can read there the definition, but basically the benefit period for hospital stay covers from when you get admitted to the hospital until 60 days after you're discharged. That's a benefit period. And the point of that is, you get released, you get discharged from the hospital, but then 2 days later, something's still not right, you go back in, you're still part of that same benefit period because 60 days hasn't passed. That actually happened to a family member not that long ago. So, but the first 60 days, you pay nothing after you pay the deductible. But from days 61 to 90 in the hospital, you pay $419 a day. So that's a lot of money. And then beyond the 90th day, you pay 838 days for what they call a lifetime reserve day. You basically get 60 lifetime reserve days that kick in after the 90th day of a stay in each benefit period. And then if you exceed all of that and you use all of those 60 days, then you pay all of the additional costs. All right, so that's at a high level Part A. With Part B, there is a deductible. It's not very much. It's $257 a year. That will no doubt go up in 2026. But Part B generally only covers 80% of the costs, and you are responsible for the rest. And so that's how Part A and Part B works, and that raises a big question. You could be on the hook for a lot of money, and before Medicare, if you have a policy like we do, we have a PPO. It's expensive, but there's a sort of an out-of-pocket cap. There's the most we will have to spend in a given year. With original Medicare, Part A and Part B, there is no caps. There is no, if you spend X dollars, then you don't owe anymore. But we can look at it back here. You can get what's called Medigap. And you see it here, it's supplemental coverage, and they call it Medigap because it fills in the gaps of original Medicare. So how does a Medigap policy work? Well, we can look at them. Everything are letters in Medicare, and I'm sorry for that. It's not my choice. And here, let me make sure you can see the whole screen. But Medigap policies are defined by letters, Plan A through Plan N. There are some letters you can see here that are skipped. Now, the U.S. government, Medicare, sets the standards for what this will cover. But the insurance is actually run through private insurance companies. So you would, if you wanted a Medigap policy, you would buy it from an insurance company. And you could pick the type of plan you want. I'm going to actually make this a bit smaller. Today, the most popular plan is Plan G, and it's the most comprehensive. Plan F was a bit more comprehensive in that it paid for that Part B $257 deductible. Plan G does not pay for that. Again, not a big deal, I think, for most people. However, Plan F is not available for those that turn 65 on or after January 1, 2020. By the way, the same is true for Plan C. And so I think a lot of folks go with Plan G because it's the most comprehensive. So if you take Part A and Part B of original Medicare, and you take a Plan G Medigap policy that covers all of the coinsurance and deductibles except the Plan B deductible, you've got really comprehensive insurance. You pay very little out of pocket. Now remember, we haven't talked about prescription drugs yet. That's separate. But that's a very comprehensive health insurance policy. I would say that the second most popular is probably Plan N. How's it different than G? Well, you could have a $20 copay on doctor visits. That's what that little tricky 3 asterisks are there. You can follow it down and you can see the details here. You can also be on the hook for what are called Part B excess charges. There are going to be some healthcare providers that charge more than the allowed amount from Medicare. What I've read is it's not a common thing, but it can crop up, and so Plan N doesn't cover that. And so those are the two most popular. And in fact, again, I'll link to this below the video. This comes from the Kaiser Family Foundation, which is a great resource about Medicare. But you can see Plan G is the most popular. This is based on 2023. There's still a lot of folks in Plan F, right? Because it just, for folks that turn 65 before January 1, 2020. And then Plan N is down to 10%. And you can see past that, a very small amount of folks are in different plans outside of GF and N. Now, of course, you're going to have to decide what plan is best for you. And even once you decide on the plan, you're going to have to decide where you're going to get the insurance from. So there are some resources that you can use that can help you. And let me just show you one. Actually, I'll show you two. So this is Medicare.gov. This is the home page. And you can come down here and say, find health and drug plans. And I'll link to this. And we'll just use this zip code. I think that's in Ohio. Yeah, where you live matters. And you can see we can look for an Advantage plan. We're not there yet. We'll look at a drug plan in a minute, but let's look at a Medigap policy. And it might ask us some questions. How old we are, whether male or female, do we use tobacco? Are we married? Because there can be a discount. There can even be a roommate discount. And we'll update the prices. And then you see the different plans. These plans, Plan A, Plan B, they map to the plans that we saw across the top here. And they show us the range of costs given the assumptions we've put in terms of age and gender and where we live and so on. So for Plan A, it's $105 up to $394 a month. If we we'll skip down to Plan G. Obviously, you can look at all of this in detail, and I encourage you to do so. Here's Plan G. So that's the most comprehensive, and it's $135 to $513. Some of these insurance policies can offer a little extra, but remember, by law, they're required to cover what the U.S. government and Medicare says they have to cover for the plan type, in this case, Plan G. But it may surprise you to see such a wide range of prices, given that they all pretty much cover about the same thing. I won't go into too much detail on pricing of Medigap, other than to say there are think of three different ways Medigap policies get priced. One is what they would call community pricing, where they don't factor in your age. The fact that I've put in that someone is 65, if it's community pricing, there'd be the same price if I put in the age I said they were 85. And then there are some plans where they do factor in the age, but only when the insurance is first issued. So the first time you sign up, your age is a factor, but after that, it's not a factor for pricing. There are other things that are, like inflation. The cost of healthcare rises, and as a result, your premiums will go up, but they won't go up because of your age. And then there's what they call attained age, where every year they do look, oh, you're a year older. Okay, well, you're probably going to use a little more health care. That's what the statistics tell us. And so your premium will go up, not only because prices have gone up, but also because you've gotten a year older. And one isn't better than the other. There are pros and cons of all of that. Maybe I'll talk about that in a future video. But this is, again, where if you get help, they can help you sort through all of that, and I'll give you some suggestions in a minute. So back to the table. So that's Plan G. They do have a high deductible where they don't pay 100% of your costs. You're going to pay some. In this case, $2,875 deductible. But maybe you can self-insure that amount. Maybe you say, I can cover that if I had to. And you can see the prices are much, much lower. So for any of these, you can actually go in here and view policies, and it will actually pull up very specific policies and the costs, and you can drill down. In this case, there were 45 Medigap policies based on the data that I put in and the location, the zip code, and you can go through and look at what they have to offer. Now, a lot of this is overwhelming. We haven't even gotten to the Part D drug plan, let alone Medicare Advantage plans, which we're going to get to. So in the third video, I'll talk about how to get help. But I will say that below this video, I've linked to a PDF of this book. This book, it's not that complicated. Yeah, I kind of think it is, if you ask me, but it's not that complicated. This is an excellent resource. It's shorter than the Medicare document I showed you. It's about 80 pages. This is a 2024 version. I have the 2025 version linked below this video. I partnered with the company behind this book, Chapter. You can get free Medicare advice from them. I will link to their phone number or show you the phone number below the video. So they are an advertising partner of this channel. I've picked them because I think they do right by the folks that call them for advice. But I put all of my advertisers on probation permanently. So if you use them, let me know how it went. I'm always reevaluating, and I'd love to hear your experience with them. So yeah, just let me know. All right, so that's Medigap. What about prescription drugs? So we can do the same thing that I just walked through. And let's see here. We can start, we'll use the same zip code, and now we're gonna select Part D, find plans. And the one thing you can do here is you can put in the drugs you take, and that's very important because you want to make sure that the drug plan you choose covers the drugs you're taking, and you'll want to know what the costs are. I put Lipitor here just because it's a fairly common drug, and you can put in whether it's a brand. Let's cancel this. I'm going to remove this. I'll show you how to do this. It's really easy. You just type in the drug name, and it fills options. And if you add this drug, you can pick generic or keep the brand name, depending on whatever your choice is. We'll just add the generic, and you can set the dosage, quantity, frequency, and you can add that to your list. Whoops. Well, I guess that's the generic version. So once you're done with that, and you may have many more to add, and I encourage you to do that, you've got to put in a zip code, and you pick a pharmacy because some of these plans are specific to pharmacies. Since this is in Ohio, I can see there's a Kroger there, and a mail order. You can get it by mail order, and we can continue to the plans, and then you see the plans. Some of them are actually zero premium, but of course they have deductibles, and you can see there are a lot of different options. One of the things you'll notice is the star rating, and that's something that Medicare does to give you an assessment of the plan compared to other plans. And you can put some emphasis on the star rating, but again, you want to focus on, does it cover the drugs that you need? And of course, what's going to be your total cost, not just the monthly premium. As you can see, there are a lot of options, and so you need to think through this carefully so you can get the options that are best for you. So that is, in a nutshell, original or traditional Medicare, Part A and B. And then if you want a Medigap policy to cover what parts A and B do not cover, and then Part D for prescription drugs if you want that coverage as well. And so those numbers can add up. I'm not going to kid you. When you add up the Part B premium, and then the cost of a Medigap policy if you go that way, and the cost of a drug policy, they can add up. And so what do we do, and how do we compare that to Medicare Advantage? Well, Medicare Advantage is known as, just to confuse us, Part C. But everyone calls it Medicare Advantage, and so that's what we will call it. And if we go back to the original slide we looked at, you see that Medicare Advantage is here on the right, again, also known as Part C. And what it does, it in effect wraps Parts A and B and Part D in most cases. Not every Advantage plan covers drugs, but most of them they do, and you'll want to make sure, they cover the drugs that you need. But they wrap all of those together into a single Advantage policy. And as you can see, most plans include Part D. They also include some extra benefits. So they often include vision and dental and maybe hearing benefits that original Medicare doesn't. And Advantage plans tend to be less expensive. So far, everything I've said seems positive. I guess everything I've said about Medicare Advantage plans is positive, right? They tend to be lower cost because here's the deal. You still enroll in Parts A and B, and you still have to make the Part B premium payment. But Medicare Advantage plans themselves generally don't require any additional premium over and above the Part D premium, and some of them even give back to you part of the Part B premium that you have to pay. And so the overall costs out of pocket initially are lower. So right now you may be thinking, if this is all new to you, Rob, why didn't you start with Medicare Advantage? Why didn't we just start and finish with that one and just forget original Medicare? It sounds terrific. Well, you have to keep a couple of things in mind. Policies under a Medicare Advantage plan, they still have Part A and Part B, but they're administered by the insurance company. With original Medicare, they're administered by the government. And when they're administered by an insurance company under an Advantage plan, you've got to follow those insurance company rules. And they typically are either part of an HMO plan or a PPO plan. Now, with an HMO plan, you are limited to the doctors in that HMO network. You have to use those doctors. You can't go outside that network, except maybe in an emergency situation. You generally can't go outside of the HMO network. You have to use doctors in that network. And with PPO plans, they both have in-network and out-of-network doctors. So you can go out-of-network, but it's usually going to cost you more. There could be higher out-of-pocket and deductibles that you have to deal with. And in my experience, because my wife and I are on a PPO plan, not a Medicare version, but we're on a PPO plan, those doctors, they don't submit the cost to your insurance company, so it results in a truckload of paperwork, whereas you submit these claims from out-of-network doctors. With original Medicare, you can see whatever doctor you want, anywhere that doctor happens to be located, as long as they take Medicare, which the vast majority do. So with original Medicare, there's no insurance company, so to speak, between you and the doctor. With Medicare Advantage, there is. So not only can they limit which doctors you see, which, by the way, can be a big issue if you travel a lot, because these networks tend to be located locally. So if you spend a lot of time in an RV traveling around the country, you may find yourself in a place where with an HMO, you can't see any doctor. And with a PPO, you can see a doctor, but it's going to be out of network and it's going to cost you more. The other issue with Medicare Advantage is prior authorization. It's often the case that a doctor might want to perform a test or have an MRI or do some kind of, provide some kind of healthcare service. But before they can do it, they've got to call up the insurance company and find out, make sure it's okay. And, a lot of times that goes off without a hitch, but sometimes it creates a real issue. You don't have that with original Medicare. Strictly speaking, there are some limited times where a prior authorization is required with original Medicare, but it's very, very minor. I read one study where, I think it was for 2023, there were about 400,000 prior authorization requests for original Medicare. For Medicare Advantage, it was 50 million. So it's a big, big difference. So there can be a lot of headaches with Medicare Advantage that you don't have with original Medicare. The other thing is, again, depending on the policy you pick, there could be some big deductibles that you have to deal with. And let's take a quick look at that. Let's see here. This is, I went through the same process that I showed you before with Medigap and with drug coverage, but I picked Advantage plans. And so here are a number of them. This again happens to be in Ohio. This is an HMO from Mount Carmel. So it only has in-network, right? It's an HMO. There are no out-of-network options, but they have a $3,900 deductible. If we go to a PPO, let's see. Here we go. You'll see in and out-of-network costs, and they can get high, $9,550. If it's in-network, it's still high, $4,900. And so, your premiums are lower with a Medicare Advantage plan than when compared to an original Medicare plan with Medigap and Part D policies. But if you have to use the insurance, you could end up spending a lot more. And so that's a lot of the trade-offs between original Medicare and Medicare Advantage. And the thing I want to just urge is that you really think through carefully what's best for you. What I bristle at is when I see brokers pushing a Medicare Advantage plan because you're going to get free dental. that's that benefit just doesn't have a lot of value to it. It's like letting the tail wag the dog. Yes, it's a nice add-on if a Medicare Advantage plan makes sense for you. Sure, take the free dental, take the free vision, but for goodness sake, don't pick a Medicare Advantage plan because of those benefits or because it's going to give you some type of free gym membership. Those should be add-ons once you've already decided that Medicare Advantage is right for you. So who does pick Medicare Advantage? Well, a lot of times folks pick it because of cost, because the premiums, as we've seen, are a lot less expensive. So that's a big reason people pick Medicare Advantage over original Medicare with a Medigap and Plan D policy. Another reason might be that you actually want an HMO plan. Maybe you've been with Kaiser Permanente for many years during your working career, and you've had their HMO. All your doctors are part of Kaiser. You're happy with that integrated care, and that's what you want with Medicare. Well, you're going to need a Medicare Advantage plan to get that. You can't get that through original Medicare. And so, yeah, there can be good reasons to pick a Medicare Advantage plan, in my opinion, but there can be a lot of bad reasons to pick it too. So be very careful as you think through it and determine what is best for you. Now, I'm recording this towards the end of September in 2025. Starting October 1, you're going to see a flood of advertising. Most of the advertising is going to be promoting Medicare Advantage plans, and they're going to talk up all of the benefits, the lower premiums, the extra benefits like vision and dental. Hopefully now you know, yeah, those are some positive things, I suppose, but there are a lot of downsides to Medicare Advantage plans too, and you need to weigh those carefully. Now, one big question before we end this part one of the three-part series is, well, can I make changes? If I pick one plan now, in a year or two, can I switch? Well, let's think about how insurance works. One of the things that insurance companies can't allow you to do, this is true if it's administered by the U.S. government, is pick a cheap policy while you're healthy, and then once you get sick, say, oh, wait a minute, I want the Cadillac insurance now because I really need health care. Let me just switch over to the best possible plan. And so there are rules in place that keep people from doing that. What do those rules look like? Well, for example, if you decide I'm not going to have any drug coverage at all because I'm not on any prescription drugs right now, and you wait 10 years until you're 75 and then you need some prescription drugs and you try to enroll in a Part D prescription drug plan, you're going to get penalized. You're going to pay a lot more because of what are known as Part D penalties because you didn't have any drug coverage at all for 10 years. You're going to get penalized to encourage people not to do that. The same is true with Medigap. When you first enroll in Medicare, let's say at 65, you can get a Medigap policy and there's no medical exam. It doesn't matter what your health condition is. You could be very, very sick and you could still qualify for a Medigap policy, and your price that you would pay would not reflect your current health conditions. But if you later on want to get a Medigap policy, you could find that your health does matter. It could prevent you from getting a Medigap policy, or it could end up costing you a lot more. Now, there are a lot of rules around all of this. When you can switch, how it works, can you get a policy or not, what will your penalties be? And we're going to cover that in video 2 when we look at changing from one policy to another or from one type of Medicare coverage to another. So that's in the next video. And again, there's a link to that video directly below this one. So there you go. I know there's a lot involved, and frankly, I've only scratched the surface of Medicare in this one video. I could say a lot more between original Medicare and Medicare Advantage plans, but I think it's enough to give you the basics plus the resources that I've mentioned that I'll link to below. If you have any questions, leave them in the comments below. I'll do my best to help you out any way I can. And until next time, remember, the best thing money can buy is financial freedom.